Good. Where'd it go? All right, so the most important thing that I do in my office is
Adjustment.
this class. Not an adjustment.
Who would have thought?
To me, I'm sorry.
So the reason why this class is the most important is because most people think that chiropractic, when you go to a chiropractor for the first time, what's it for? Because what do they have?
Pain.
Pain. Most people believe that chiropractic is for pain, and after this class, you're going to learn chiropractic can't fix pain. Bummer. Who wants to walk out? Be able to be in front of the camera. So, but what I do want to teach you is what chiropractic really is for. What really happens when you're being adjusted. So that you totally understand, and you don't think people are popping and cracking your back, right? So, I want you to understand the science of chiropractic, how it works, why it works, when it doesn't work. When it doesn't work, where should you go, right? So I don't leave you hanging. And why do people come in when they're feeling good? Why do people come to my office when they're feeling great? No symptoms at all. So we're going to learn the importance of that too. Okay? So my first apology for the class. I went to seminary school. I know, sorry. So it's okay to be politically incorrect in my office? But here's one thing I never want you to hear out of your mouth in my office. I never want you to say, I believe in chiropractic. Because I never want you to believe in chiropractic. If you come to my church and you want to join my church, you have to believe what we believe, right?
Yeah.
But in my office, I don't ever want you to have to believe anything I've told you. It's a science. I just want you to understand it. So if you can understand what chiropractic is, it's just a tool. And if you had a bowl of soup, what kind of tool would you want?
A spoon.
A spoon, right. So chiropractic is kind of like a spoon. It's a spoon to take care of a subluxation, which you guys are going to learn about. But if I hand you a steak, you want a spoon?
No.
No. So I'm going to teach you what to do when you don't have a chiropractic problem too. So in order to understand chiropractic, you have to understand how the nervous system works. So what controls and coordinates everything that goes on in your body?
The brain.
Your brain. See, she cheats.
I'm sorry.
No, you're right. I want you to cheat. Good. Your brain. Life is actually produced in your brain. Life is really, your brain is like a generator. It produces these electrical impulses, and the electric that your brain produces goes down these wires called the nerves out to every part of the body. Life is really what heals the body. Uh-oh, now it sounds like theology school again, right? Life heals the body? Come on, I was here for science. It's science. So if you scraped your finger, if you had a little scrape on your finger, what kind of doctor can fix that?
Me.
Yeah, you're the only one. No doctor on the planet can fix that. You're right. Guys, yeah, she's brilliant. I'll tell you. So, doctors don't get you well. Doctors remove interference so that your body can heal itself. Life, that electrical impulses, when you cut your finger, it sends a message to your brain. And does your brain send a message back to your finger? No. Where does it send a message to? Your liver, to produce chemicals to stop infection. And then it mobilizes proteins to go, and does it repair the cells in your finger? Nope. It replaces them with healthy cells. So healing is really when these sick, dead, or dying cells in your body, when you don't feel good, are replaced by healthy cells. That's really healing. Life does that from your brain. So the real reason for a chiropractor is to remove the interference in that electrical impulses between the brain and the body so the body can begin to heal itself. That's it. That's all chiropractic is. So since the only thing I'm ever going to touch on your body is your spine, I want you to know what I'm doing. Now, you're going to be so much smarter than most doctors in town, I promise. So, I'm going to ask you questions about the spine, and the answers are up here. But I'm not going to tell you in that order. Okay? So, I'm picking on you first. You came in last. I told you. There's nobody to help you out right now. You see these shock absorbers in between the bones? Those shock absorbers? You know what they're called? What are those called?
Spinal nerves?
No.
No, they're the discs. aren't
Discs,
they?
yeah, we got help from the audience, good.
Yeah, thank you.
Discs, yeah, those are the shock absorbers between the bones. Those are the discs. What are the bones of the spine called? Your turn.
Oh.
What are the bones of the spine called? Which one? There's only 3 left. Are the bones called vertebra, spinal cords, or spinal nerves? Go ahead, help her out. Huh?
I think
The bones.
Spinal cord.
No,
Oh,
The
see,
bones.
I'm wrong.
the vertebra.
Oh.
2 for 2. You go, girl. Inside of this sheet of armor that's protecting your spinal cord, that's protecting your whole nervous system, inside of that sheet of armor, everybody's got a clear plastic tube. See it?
Mm-hmm.
Everybody's got a clear plastic tube inside their spine. People do not have a clear plastic tube inside their
No.
spine. Well, what does that represent? What does that represent? It's the big tube
The
that goes...
spinal cord?
Spinal cord.
Good 3 for 3 over
3 for
there.
3. You go, girl. One more and you got it. There's only one more choice, right?
Yep.
And these nerves that branch and supply every one of the 70 trillion cells in your body right now, maybe about 50 trillion in yours, 70 in ours.
Oh, shoot.
What are these nerves called that branch and go to every single cell in the
I'm not
body?
helping you guys this time.
Come on.
Spinal nerve.
You got
Here
it.
we go.
Good job. You let her have it. You get bonus points for that.
Right.
All right. So now you know the anatomy. So you know the discs, you know the vertebra, you know the spinal cord inside that sends the message from the brain to the body, and you know these spinal nerves. Is there any cell in the body that can live without a nerve supply? There are 2 kinds of cells only, and they're dead.
Your hair.
Hair and
Nails.
nails. They can live without a nerve supply.
Yes.
You can cut them, right? They don't hurt. If any other cell in the body, if we stop this nerve, if we pinch this nerve and stop it from going to any cell in the body, what will happen to those cells?
Got that?
They'll die. They'll die. So if we put a little bit of pressure on those nerves, they get sick. And that's really what happens when your bones are out of line putting pressure on nerve. There's only one big word that I'm ever going to make you memorize in my office. One. But you're going to know it before we leave. That's it. One word. You okay with that? All right. Vertebral subluxation. Subluxation. It means sub means less than. Lux is life or alignment. And ation is a condition of. It's a condition where the bone is slightly out of line, preventing that life from going along these nerves out to the cells of the body. Vertebral subluxation. So when the bones misalign, we call that a vertebral subluxation. There's 3 kinds of vertebral subluxations. Everybody turn in your chart, new page to the chart with the spine on it and all the nerves and where they go. Okay? Now, I'm picking you first because you're the smartest person in the room. Pick a number between 1 and 12.
5.
5. 5T. 5T. Where does 5T go? Where does that nerve go?
Oh, jeez.
Yeah, where's it go?
What?
5T goes
Liver.
liver, solar plexus. That's the stomach, right? And where else?
Blood.
Some of the blood. Okay. So if this 5T, 1, 2, 3, 4, 5, if that 5T had a vertebral subluxation, it would look like this. See, the bone doesn't line up anymore? Watch what happens. If I put this bone out of line, what happens to that nerve? Now, the muscles are tight on this side, pulling it out, but on this side, what happened to that nerve?
Got
What?
it in the line.
What if your finger was in there with that nerve? What would happen to your finger?
It would bend.
It would bend. What do you think?
Wow.
It would actually get
Pinch.
pinched. So a subluxation, when a bone goes out of line, actually puts pressure on the nerve and pinches the nerve. Anybody heard the term pinched nerve before?
Yes.
All right, now you know what it looks like on the inside when you get a pinched nerve. All right, now watch. Everybody's so impressed when a chiropractor finds a subluxation.
Mhm.
Oh, you found exactly where it is. It's not
That's
that
what I
impressive.
said today.
It's not that impressive. It's actually pretty easy. Watch. I just want you to feel the back of these bones. These are called the spinous process. Just feel. See how nice. Oh, that one's out of line, right? Feel how nice and straight they line up. See that? It's easy to feel that they're lined up, right?
Yep.
But if I took that T5, 1, 2, 3, 4, 5, and I tighten the muscles, and I put it out of line, feel it again. Uh-oh, is that hard to feel?
Yes, no, it's not hard.
It's easy, right? It's easy for a chiropractor to find a subluxation. Feel it? See how you can feel it right away? It doesn't line up? So when I feel down your spine, that's what I'm feeling for. Now that's a pretty bad subluxation. That's a lot of pressure on that nerve, right? If I put it out of line just a little bit, just a tiny little bit, feel it again. You can still feel it, couldn't you?
Yeah.
So a little bit of pressure stops the brain from communicating a little bit, but a big subluxation, when muscles get really tight and really pull it out of line, that really interferes with the communication between the brain and whatever that cell. This one's going to the liver. Anybody know a disease of the liver?
Cirrhosis.
Cirrhosis, right?
What is it?
Where the liver begins to break down,
Right.
gets diseased. The only thing a chiropractor can do, period, is detect and correct a vertebral subluxation. That's it. If a chiropractor tells you they're fixing something else, they're lying. That's the only thing we're trained to do, detect and correct subluxations. So, if you saw this on me and you were the chiropractor, what would you do? How would you fix that?
I know.
Would you leave it out of line? My liver's not getting a message. How would you
I'm in
fix that?
trouble here.
Show me. Show me how you would put this back in line with those.
Gotta adjust them.
Go ahead.
I know.
Go ahead, do it.
You're afraid?
Congratulations, you just made your first chiropractic adjustment. You're going to help me on Saturday. Saturday between 10 and 12 is when we're the busiest. If you have some crazy desire to wait in my office,
Come on Saturday.
come on Saturday between 10 and 12. I sit here twiddling my thumbs from 7:30 in the morning until 9. See maybe 10, 12 people. Between 9:30 and noon on Saturday, typically we'll see about 100 people.
Wow.
Not a wow. I keep up. Greyhound buses pull up in front and they let 35 at a time. This room gets full. So don't yell at me if you come on Saturday morning. It's okay. Just bring a book. Make sure that you know that might be a little bit of a wait. But I don't ever leave this office until everybody is seen. Typically, on a typical day like today, we saw about 100 people. So on some days we see 150 to 180 people. But there's usually not that much of a wait because everybody that's been to this class, they kind of know what they don't have to ask a lot of questions in the back because they already know what to expect when they're in the back. So after you fix that T5, the person comes in and says, "Doctor, my liver tests are coming up normal. You fixed my liver." Can chiropractors fix liver problems?
No.
No way. Only thing a chiropractor can do is detect and correct a vertebral subluxation. That's it. But when you remove the pressure on that nerve and the brain begins to function to that organ, the organ begins to function normally again. We can't fix the organ, can we?
No.
All right. Good job.
Oh.
Pick a number between 1 and 5.
3.
3L. L3 in the lower back. So you'll see it towards the bottom.
Oh.
There you
All
go.
right.
Sex
Read.
organs,
Yep.
ovaries, testicles,
And what's the last thing?
uterus, bladder, and knee.
The knee. So it goes to the pelvic organs and the knee. So somebody comes hobbling into the office, right? They have knee pain. When this lumbar subluxates, when the lumbar spine subluxates, see that?
Yeah.
It subluxates this way. Watch these nerves. What happened to those nerves? Put your finger in there with that nerve. I won't go hard, I promise. What happened? Feel it? It's
Yeah.
pinched. That's what's happening inside your spine. So, pinched nerve, right?
Right.
Do you see that? How it gets pinched?
Yeah.
All right, now, if I saw that, I might put you on your side, might I? Now you're going to know what Dr. Bouchard was doing all those years.
Okay.
And he would put his hand right over your hip, right? So take
Yeah.
your left hand, put it over this hip. And he would bring it see the nerve?
Yep.
He would bring that hip down towards the feet, right?
Yep.
Go ahead, do it. What just happened?
Just came back.
Congratulations, you just made your first chiropractic adjustment.
Huh.
Fantastic, right? So that's why we put you on your side. See the nerve?
Yeah.
on the side or on the
Wow.
back, see the pinch nerve,
Yep.
to open that up and remove a lumbar subluxation.
Huh.
Now you know the two kinds of subluxations, thoracic and lumbar. Now the most important subluxation is in the cervical spine, the neck. Do you remember Christopher Reeve?
Yes.
He was this actor guy who fell off his horse and he broke his
I'm Superman.
neck. Now the brain doesn't end at the bottom of the skull. The brain sits in here. Remember, it's making all this electricity,
Yeah.
Yep.
and it sends it down the spinal cord. Well, the first two bones in your neck actually protect the brain, because the brain it doesn't become the spinal cord until 3 bones down.
Huh.
So if the brain is sitting inside of these bones, see the brain, and this bone goes out of line even slightly, what happens to the whole?
Oh my goodness.
And that's called cord compression. It's actually compressing the spinal cord and the brain stem. See it?
Huh.
See that how that
Yeah.
happens? Now Christopher Reeve didn't break the first or second bone in the neck. He broke the third one. But what did it affect? Did it just hurt his neck?
No.
What did it affect?
His spinal.
Everything
Cord, yeah.
below, right? It affected everything below. So when the first bone in your neck goes out of its normal alignment, it affects
Everything.
everything below. Yes, it goes to the head and face, but everything below it. So when I adjust you in the office, have you ever noticed where I start?
Your ankles.
At the bottom. And where do I end?
Your neck.
Because if I leave that out of line, even if you came in with low back pain, if I adjust your low back or your middle back,
Right.
and I leave the neck alone, which somebody wanted me to do, what could happen?
Hey, everything could.
Totally miss the problem and you won't get better. So the top of the neck is the most important part of the whole nervous system. Pick a number between 1 and 7.
6.
C6 or 6C. Bet you can't guess how many bones there are in the neck. 7.
Neck muscles, shoulders, and tonsils.
Okay, so neck and shoulders and throat. Okay? I'm going to subluxate. Well, this guy is easier. I'm going to subluxate C6. Okay? See the nerve? See what happens? Now, the nerve that goes to the neck and shoulders is pinched.
Oh, no.
Okay? Would you leave me out of line like that?
No.
Right?
Oh.
Nope. So what would you do?
Like that.
Congratulations. You just made your first adjustment. Good. So now the person comes in and said, "You fixed it. My neck and shoulders are totally better. You fixed my neck and shoulders." Did you fix their neck and
No.
shoulders? What did you do?
Just align them.
All I did is detect and correct the subluxation. That's it. It's more important than that in the neck, though. It's more important because inside the bones of the neck, you see the red thing?
Mm-hmm.
You know what that's called?
No.
It's the main blood supply to your brain. It's so important. It's protected by bone. God didn't want you to bang into that.
No.
So, it's called the vertebral artery. Tell me what happens to that vertebral artery when you have a subluxation in the neck.
It's pinching it. It's
Now, did it pinch both arteries or just one?
No, just one.
Just one. Now the bone went to your left. Which artery is pinched? Left or right?
All right.
The right, the opposite side.
Hmm.
So when you have a subluxation in the neck, it doesn't just affect the nerves, it also affects blood flow. What kind of headache is a blood flow headache?
Oh, I know that one.
What's it called?
Oh, migraine.
A migraine.
Mm.
So when someone comes in with a migraine,
I do.
and we put the bone back into place, and what part of your spine showed up red?
My whole neck.
Yes,
And we put the
mine-
bone back in place, and blood flow is restored to the head. Guess what somebody says? You just fixed my... Did I fix their headache?
No.
I didn't touch their head. What we did was take pressure off the nerve and the artery so that it opened up. Did you ever have an adjustment? You've been adjusted for a long time
Yeah.
with Dr. Bouchard, right?
Yes, many years.
Has he ever adjusted you and you felt a little lightheaded afterwards?
Oh, yeah.
Now you tell me why that happened. Now you know.
Because
What
the
happened?
blood flow.
Increased and you got a little bit more
Yeah.
oxygen. And how long did it last? About
Not very long.
10 to
yeah.
15 seconds, right?
Yeah.
It's just the increase in oxygen. Your body's getting used to that. That's important for adults, but it's more important for babies. In 1984-ish, there were the first studies done on sudden infant death.
Oh.
And here's what they found. Those Those children died of what? What's it called? That last word?
Hypoxia.
Hypoxia, the lack of blood flow to the brain. Right? Not enough oxygen. So here's what happened. So during the birthing process, so God doesn't make any junk, right? So in the mother's womb, the spine's straight, right? During the birthing process, whether it's a vaginal birth or a cesarean birth, the head comes out first. In a cesarean, they yank the baby with about 120 pounds of pull. But during a regular vaginal birth, the head comes out first. And what do they have to do to get the shoulder?
I have to twist
Turn
it.
the head. Does that look at all like something I might have done to you in the past?
No.
Maybe? This evening, maybe?
Well,
Yeah.
yeah.
Okay, so if the neck is perfect before the head is rotated, what might happen to this spine? You might wind up with what in the neck? You might wind up with a
Pinch it.
vertebral subluxation, right?
Wow.
So we subluxate that C2 by rotating it, and it puts pressure on that artery.
Right.
See the subluxation?
Yeah.
Now, the research said it was a second vertebra that went out of alignment. Second one that went out. This only clogs one artery, remember?
Yeah.
Yeah.
So far.
So now if the neck goes the opposite way,
So
oops, it's not going to let me do it. Come on. There we go. Now it puts pressure on the opposite artery, and both arteries are closed.
Right.
So when they found that out in the research in 1984, they said, oh, the neck could possibly be out of line. Before 1984, what was the proper way to put a baby to sleep? In what position?
On the stomach?
On the stomach before 1984, right? But what did that do to the neck?
Yeah.
Turned and closed the other artery.
Oh, that's why.
After 1984, when they did the research, they showed that I just showed you. So now, which way are you supposed to put a baby to sleep today?
On
On the back, because it stops that hyperrotation.
Mm.
So let me ask you a question. What makes more sense? Changing the way we put a baby to sleep? Or checking them at birth, like all those
Checking them
babies'
at birth.
pictures that hang on the wall? Now you know why the babies' pictures are hanging on the wall? They were checked before their first day of, within their first 24 hours of birth. That's the ones I put on the wall.
Wow.
So about half those babies, when I go in and check them, I find a subluxation, and what do?
Huh? You just-
I put it back in place. Now, when I adjust a baby, this is the amount of pressure. It's just a tiny,
Right.
tiny little amount of pressure, because there's no muscles in the way.
Right.
You put it back in place, and usually the mom says, oh, the baby's turning ahead to nurse now. He wasn't nursing on this side
Oh
of her.
my God.
So those are the babies that we adjust.
Wow.
So now let me ask you a better question. How come every single parent doesn't have a chiropractor come to the hospital
Yeah.
to adjust the baby?
Good question.
Yeah, why?
Yeah, why?
Because they thought the same thing you did before we started this class. What's the reason for going to a chiropractor?
To adjust your spine.
Because you're in,
Pain.
and you know what a new parent says? My baby looks great, my baby looks fine, my baby's not in pain, don't touch my baby. Because they don't understand that
That's right.
chiropractic is not for pain,
That's
treating pain.
True.
Chiropractic
I
is,
wouldn't have let a
Yeah.
chiropractor
See?
touch my...
but once you understand what it really does, and it's just about
Oh.
lining the vertebra back up to take the
See,
pressure off the
should've brought
nerve.
Joshua from day one.
See, so, see, poor Joshua.
Oh my
So-
gosh.
So that's the reason to have a child checked. Not to because they're in pain or they're sick.
Right.
Once they're in pain or sick, what did I just do?
Go-
I guess call in for a
Yeah.
second opinion and do medicine, right? Or
Yeah.
go the medical route. So prevention, not treatment. That's what
Wow.
chiropractic's really
Hmm.
for.
So interesting.
All right, so now you know what a cervical subluxation is,
Yep.
a thoracic subluxation, and a lumbar subluxation. So now you guys are way ahead of most of the medical doctors in town, but not the ones that come to my office because they understand.
That's
And about half the doctors in town, they are our patients here. So,
Oh.
so not anybody from that pediatrics group, but the other one, yes. Who was the obstetrician that worked on you guys? For you guys, was it the one right in town?
Yeah.
All right, so I can't say any names,
I can't even remember their names.
but two of those doctors are patients here too. So they understand the problems during birth, and that's why they're calling in more and more for chiropractors to check the children.
Nice.
All right, so subluxation is just a bone that falls back out of line, puts pressure on the nerve, and it just interferes with the communication between the brain and the body. That's
You know, I'm
it.
so spacey when my neck's out.
You got it, because it
Yeah, I
really is
said that
interfering with the
yesterday.
messages, right? So, everybody turn, keep it on there, T6. 6T. Where's it go?
Stomach.
Stomach.
To your stomach. Okay, so this is an analogy. This is how Jesus talked.
Okay.
Parables. All right, so now we're going to learn. You see the electrical outlet on the wall?
Yeah.
It makes what?
Electricity.
Electricity. What makes electricity in your body? Your brain. See, I told you, bring along the smart
I
kids.
know.
Yes.
So your brain produces those electrical impulses that sends to back and forth to the
Yeah.
body. This cord is a lot like what in your body? It's a lot like your
Spinal cord.
spinal cord, right? Takes the message.
Yeah.
This dimmer is a lot like two bones in your the two vertebrae, because I showed you when a bone goes out on a little bit
Yeah.
or a lot. It's just like this dimmer being turned all the way on or slightly off, right? So the more the dimmer is turned, the less
Right.
message gets through. This is going to represent your stomach. But in your case, it can represent your neck and head. It can represent your middle back. It can represent your immune system. It doesn't matter. These cells are just your stomach. That's the one we're going to talk about, just for example. So if there's no subluxation in this dimmer, it's wide open. They're perfectly in line, and this message is getting from the brain to the body. How will this light bulb look?
Right.
Yeah.
Bright. You'll be a bright light bulb.
Yeah.
Get it? Now I know why I say bright light bulb. All right. So you'll be a bright light bulb. Now, health is when 100% of your cells are functioning at 100% of their capacity, 100% of the time. Right? So that's health.
Yeah.
Let's pinch the nerve a little bit. Just put that T6 out of line just a little bit. Okay?
Yeah.
You saw I showed you a little bit or a lot, right? Let's pinch it a little bit, just 10%. About the weight of a dime. 2 millimeters of pressure. Did you notice how, did it get dimmer?
A little bit.
A little tiny bit, you're right. It did. This person is 90% healthy now. But they're also 10% diseased, we call it. They're 10% diseased. They're not at ease. Diseased. If you're a medical, that's called disease, right? They feel fine though. They feel great. There's nothing wrong, right? Nothing wrong. I feel great.
Yeah.
Let's pinch the nerve a little more. Put it out of line a little more. See me turn it down? Did it get a lot dimmer?
Not a lot.
Still pretty bright, right?
Yeah.
If I turn all the lights, this is still light in the room.
Yeah.
Now they're 80% healthy and 20% diseased. Still feel great, right?
Right.
Now we're going to cross the pain threshold. We're going to put the weight of a nickel on there, about 5 millimeters of pressure on the nerve. 30%. Oh, now we start belching. Oh, can't possibly be the nerve. It was just that soda we drank at lunch, right?
Yeah.
Now we're burping, we're belching, right? Don't drink soda, it'll make you belch.
Good night.
Let's pinch the nerve a little more. Bloating.
Good.
Oh, you know what the bloating is from? It's the Mexican food that we had for lunch, right? I'm feeling really bloated. Not good. Can't possibly be my nervous system. Those headaches that are coming and going, it's just, they're normal headaches. Normal headaches, what does that mean? Ridiculous. My back pain, it's just a little achy. This is where you start making excuses, right?
Right.
I'm fine, I'm
Yeah.
fine, it's gonna go, it'll go away.
Right.
I'm fine, right? Nausea. See the bulb, what's happening?
Yeah.
I know what this is. I know what this is. I saw this on TV.
Oh, jeez.
Belching, bloating, indigestion. Belching, bloating, indigestion. Belching, bloating, indigestion. I must just need some
Tums.
crazy, isn't it? They bought shelf space in your head, not at the pharmacy. Up until now, it's okay to see a chiropractor. It is. This is where chiropractic works best. You take the pressure off the nerve, the body begins to heal itself, and it gets better. However, this is also the area where TV commercials and medicine
Yeah.
begin to brainwash you
Right.
Right.
to try to hide the symptoms instead of treat the cause. Back, it was funny when they bought shelf space in our head, right? I'm going to say something. You try to stop yourself. I'm going to prove to you they bought shelf space in your head. I'm going to prove it. You won't even know what I'm talking about. Having problems with digestion? How do you spell relief?
Rolly. R-O-L-A-I-G-S.
Can't stop yourself, can you?
Yeah.
They bought shelf space in your head. But today they're doing something egregious. Because you know what shelf space they're buying in her head? You're numb to it now. But what are they targeting our kids for? Just turn on any sporting event, any news channel, and watch the commercials. What's every other commercial? Every other commercial is for
Something.
prescription drugs.
Yes. And don't take it because my goodness.
And they tell you, what do they tell you?
Side effects.
They tell you,
Yeah,
not
I
feeling
know.
good, you feel a little depressed, right? Not feeling good. That's not normal to feel
Restless
depressed.
leg syndrome.
Yeah. So
Yeah.
take this medication and you'll be frolicking through the garden, right?
Right.
Through the meadow, right? They show you that. And then at the end, they're petting a cat, right? Because they're petting a cat. I'm petting a cat, nothing's wrong. May cause death,
Yeah,
Oh, yeah.
hemorrhage,
Yeah.
bleeding.
yes.
That may affect you for the rest of your life.
Yeah.
Just because they're petting a cat sounds, oh, that's not
Sounds
bad.
great, right?
Sign me up for that medicine.
Right.
What do you mean death? It won't happen to me.
Yeah, right.
But they're training our kids. Every time they're hurting,
Oh, yeah.
there's a
Yeah.
pill or a drug. Every time there's pain, there's a pill. And in school, they tell you just say no to drugs, right? Just say no. But this drug's okay. Take this drug, right? That's not cool. They're giving a mixed message. And when kids get to high school, they are hurting. Not necessarily hurting physically, but in high school is a tough place these days. And they were hurting, and every time they were hurting in the past, what'd they do? They took a
Yeah.
Okay, it does.
pill. You wonder why we have a drug problem in the United States?
Right,
We need to teach our kids that you can get yourself well. You don't need drugs or surgery.
right.
Your body can heal itself. Get it?
Mhm.
Cool. All right. So don't buy that stuff they're selling you on TV. It's a lie.
Never.
Now, after this, I need help. I can't take care of you by myself anymore. It's getting too bad. Heartburn. Heartburn is heartburn, right?
That's
Right.
bad.
When you have heartburn, it means your digestive system's not working right. And you know what system fails next?
You breathe.
You can't take in the right nutrients, so your cardiovascular system begins to degenerate.
Oh.
Shortness of breath, feeling lethargic, having trouble moving. It's heartburn that started that affected the cardiovascular system. Bleeding. Anybody know anybody with a bleeding ulcer? Can't possibly be your nervous system, huh? Right. This is where the back pain is getting so bad it won't go away anymore. It's not coming and going, now it's staying. The headaches are coming more frequently, right? You bleed long enough, how you gonna feel? How you gonna feel?
Oh, you're gonna feel
Yes.
dizzy.
Really?
Yep.
Dizzy. And people are walking around dim light bulbs.
Yeah.
If this was your T2, 2T on that chart, what's this person gonna have next? No, T2, 2T, not L2, 2T. up
Heart,
top.
including its valves and covering.
Yep. What's this person having next?
Oh,
What's this person having next if it's T2, not T6?
Coronary arteries.
Yep. They're having a
Heart attack.
heart attack. That's next.
man.
Is this the
Wow.
time to go to a chiropractor?
Yes.
No way.
No, I'm like, no.
I love you, and I care about you, and I just met you. And I don't want to breathe in your mouth.
No, no.
Or yours. But I will, because I'm not letting you die here. It's too much paperwork. We have the worst healthcare system almost in the entire world
Oh, yeah.
by the World Health Organization
Yeah.
standards.
Oh, yeah.
Below third world countries.
Yeah.
But when it comes to emergency medicine, we're almost always at the top.
Really?
So you go to that hospital, odds are they're going to save your life.
Okay, yes.
Odds
you're
are.
right about that.
They're not going to teach you how to stay healthy,
No.
but they will save your life. It's too late. You waited too long. The problem is too severe for just an adjustment. Now, my buddy who had a heart attack, and they took him up to the hospital, and they put a stent in it and saved his life, right here.
Yeah.
On the way home, where did Lori bring him before
Here.
he got home?
Yeah.
Here. Because was this subluxation helping his heart? No. But it's totally different, right? We're taking the pressure off so the body can begin to heal. They saved his life because he waited too long. Get it? And if you put more than 12 millimeters of pressure on a nerve for more than 6 months, which is called the window of opportunity, you begin to develop a thing called permanent nerve.
Damn it.
And what happens to the cells at the end of a nerve that's permanently damaged?
They just die off, right?
That's a good example. It's a good analogy for really how the nervous system works. A neurologist would show you that that's really how it goes. So don't think of me like some construction worker for your daughter's spine anymore. I'm an electrician. My job is when you come in and you're a dim light bulb, if I take the pressure off that nerve, remove the subluxation, adjust the subluxation, you become a brighter light bulb. And that's the goal of a chiropractor. To remove the interference so your body can function at its best. That's chiropractic. So how do you find a subluxation? Everybody's all impressed. Oh, how'd you find that? That's exactly where my problem was. How'd you find it?
The feel of it.
You did it yourselves. You found a subluxation. How'd you do it? You
felt for it.
And that's called palpation. Palpated for
Right.
it. Range of motion. You ever see anybody going down the road and they can look over their shoulder, no problem, and then they go the other way and they go,
Oh.
ah, what happened? So the neck was out of line this way, right?
Yeah, that feeling.
They can turn that way fine, but they can't go the other way. Subluxation. An infrared thermal scan. This picture. Anybody in the room had a picture like that? Everybody. Isn't it interesting how that thermal scan can
Yeah.
see where the muscles are pulling the bone out of line? You can detect right where the problem is.
Yeah.
X-rays can also do it, but I'm pretty much against X-raying everybody indiscriminately. It would be wrong of me to take an X-ray of everybody when I don't even let my dentist take an X-ray unless he finds a problem or I feel one, right? So that's why I don't use an X-ray machine in the office anymore. That's why I bought that $10,000 thermometer.
Wow.
So that's how you can find a subluxation. So
Yeah.
don't be impressed when I find one. They're easy to find. Remember when you first came in, you wrote down all those symptoms, right? I let you vent, right? How long did I look at that sheet?
Not even 2 seconds.
Only long enough to do what? To make sure that you weren't past here, that I didn't need to send you out. And when I detect that there's something past there, what do I do right away?
Send you to the hospital?
Send
The
for
doctor?
the doctor.
Second opinion.
Right. Because I'm going to continue to adjust you to make sure that your body is fighting as fast and hard as it can. But I might need some help because
Right.
it went on too long, or it's too severe. It's a limitation of matter. So now you know why I'm looking at those sheets and what I look at for. But I can't fix any of those things. I can't fix neck pain or back pain or joint aches. All I can do is detect the subluxation, remove it so the body can heal itself. That's why I don't spend a long time. Once I do that, though, your body is able to start fighting. Innate, that's the inborn ability to heal yourself. Innate kicks in and your body starts to heal itself. That's what chiropractic is really about. So, what causes a subluxation? Why do bones go out of line? Look at the ice cream on the ice cream scoop in front of your
Stress, for sure.
stress. So in other words, what I'm really asking is, what causes the muscles to get tight and pull the bones out of place? Stress. People get upset at me. You just fixed me. How can I possibly be out of line again, right? What happened between the last adjustment and now that we know for sure?
Stress.
Stress.
And stress comes in 3 flavors. Vanilla, chocolate, and strawberry. Mental, physical, and chemical. And scoops ice cream on your handout. Mental stress. I want you to think of one thing that stresses you out in your head. Don't say it out loud. One thing that stresses you out. Don't say it out loud. And like the amazing Kreskin, I will tell you what you just thought. Because all mental stress is only 2 things. It's relationships between you and somebody else, like family members or work, people at work, or yourself, your relationship with yourself, or finances.
Yeah.
How do you know when somebody's mentally stressed? When you just look at them. What looks different about them?
I was in my eyes.
Watch.
They're always-
Does that look familiar?
Yeah.
Your shoulders go up.
That's right.
Now watch. Shoulders go up. That's called the trapezius muscle, the traps. It connects your shoulder to the base of your skull and the first bone of your neck. It pulls C1 out of line, 1C on the chart with the spine. Where's it go?
The brain.
It goes to the head, right? Blood supply to the head, and what else? Bones of the... Yeah.
Bones of the face.
So people start coming in when they have mental stress with what? What's their main symptom?
Their face.
They have
Headache.
headaches. Do you understand now the physiology, how a headache happens
Yeah.
from mental stress? So when people say, I'm stressed, I have a headache. Now you understand why and how.
Yeah.
You understand what a subluxation will do. Physical stress, bending, lifting, and twisting, right?
Yeah.
Sports, right?
Yeah.
What part of the spine does that affect? Your neck, middle back, or lower back?
I would think, I would think lower.
Lower back,
Yeah.
right? If a chiropractor wants to stay open, he has to keep 3 other businesses in town open. The Reach and Twist Bowling Alley, right?
Oh, yeah.
The Reach and Twist Golf Course, and the Garden Center. What can you do from the Garden Center that doesn't require Reach and Twist? It's just a different season, right? Raking, shoveling,
Mine's always
gardening.
vacuuming, house cleaning is
Reach
my
and
worst,
Twist, right?
my worst.
Yeah. There's a reason why they pay housekeepers a lot of money. And I see them every week.
Wow.
So physical stress affects the lower back. Everybody forgets about chemical stress. Viruses, bacteria, viruses, and allergies, bad food supply, bad water, smoking, alcohol, terrible stuff for you. Chemicals that'll hurt you forever. Just let's think of 2 things. Smoking and alcohol. Smoking affects what in your body?
Your lungs.
Your lungs. Alcohol affects what? Talked
Your
about
liver.
before. Your liver. Those are called collectively those things are called organs. Tell me which part of your spine supplies all the organs. Take a look on the next page. Which one goes to all the organs? The C's, the T's, or the L's? The cervicals, thoracics,
The
or lumbar?
T's.
The T's, the thoracics. So when the organs begin to malfunction because of chemical stress, it goes right to your middle back, sends a message along these nerves, and it throws what part of your back out like? Middle back.
Wow.
So now you know the reason for a cervical, a thoracic, and a lumbar subluxation in general. Other things can happen now because of technology, like people doing this all day. That's
Yeah.
physical. That affects the neck instead of the lower back.
Right.
So, but in general, that's how it works.
Huh.
If you don't remember anything else about my class, this is the one to remember because it'll keep your family healthy. Stress causes muscles to get tight. Muscles getting tight causes the bones to go out of line in your spine. That's called what's it called?
Subluxation.
Subluxation. If you have a subluxation, your body's not moving properly. That's called a dysfunction.
Right.
If you dysfunction for a long enough period of time, it's no longer just pain. Now we name it. We give it a name, right? A disease.
Yeah.
Now it's lumbosacral radiculopathy. Now it's not just neck pain. Now it's cervical brachial syndrome. Now it's not just headache. Now it's a tension headache. It's a migraine headache, right? Name it. And does that make you feel better now you have a name for it?
Right.
No, it just makes you more stressed. See the hamster wheel?
Yeah.
All right. We're going to break the cycle with these blue arrows. Tell me which of these blue arrows is the most sane, easiest way to break the cycle for the least amount of money. Which one? No, that costs money. You got to go to a chiropractor for that.
Yeah.
Stress.
Yeah, you can break the cycle right here. So you can't stop the stress, but what can we do to stop the stress from tightening the muscles? It only takes 15 minutes a day. That's all it takes.
Exercise.
Exercise, yoga, walking, exercise. 15 minutes. That's all the research says. 15 minutes. Now, this is what stress does to you, right? What can we do for 15 minutes also to get those shoulders down?
Meditate.
Meditate. It's just sitting quietly. If you're politically incorrect because you went to seminary school, you can also sit and do what for 15 minutes?
Right.
Right. Right? Doesn't matter. Just sit quietly. Get those muscles relaxed. What else can we do? You live in the black hole of opportunity in Rhode Island, right?
Yeah.
What's our claim to fame in Rhode Island? You know what it is? We were the first ones to declare a recession, and the last one's out.
Yeah.
Right? That's our claim to fame.
It's like Colorado.
You know why you spend the money and pay the taxes in this corrupt state?
Oh.
So that you can go for a walk on the seawall,
I
right?
know.
Oh, yeah, you
When's the
can
last
get
time you
that.
went for a walk on the seawall? Yeah.
You can't find a parking place.
Well, let's say in September. September you can. When's the last time in September you went for a walk?
June.
Go 15 minutes is all it takes just for a walk. We're right by the ocean.
Right.
Right? So break that cycle there. It's the cheapest way. I don't have 15 minutes. I'm not taking that time to sit quietly. So you wind up with muscle spasm. Who is uniquely qualified in our community to break muscle spasm? Reduce it. A
Yeah.
massage therapist.
Thank you.
Oh, yeah.
How often should you go to a massage therapist based upon the research?
7 to 10 days.
Every 7 to 10 days.
I never went to one.
I'm not going to that massage therapist. That's $70 plus a tip. I can't afford that every 7 to 10 days. So your muscles get so tight, it pulls your spine out of line. You begin to get those cells at the end of those
Yeah.
nerves begin to get diseased.
Yeah.
You wind up with a subluxation. Now who do you have to see?
Chiropractor.
You.
Too bad. Friendly neighborhood chiropractor
Yeah.
now. We break the cycle here and here. You ever had a subluxation? How'd that feel? Pretty stressful, huh?
Mm.
And if you irritate a nerve, you put pressure on the nerve, you irritate, it sends too much message to the muscles. What do the muscles do? So, see how it can cause this cycle?
Mm-hmm.
So we break the cycle right there. We also break the cycle here, because once you put a bone in line, it's moving properly again. It doesn't dysfunction, right?
Right.
So we break the cycle here. I'm not going to that chiropractor. He wants to see you get your spine checked every 7 to 10 days. That's crazy talk. So you wind up with a dysfunction. The body's not moving properly, right?
Yeah.
Who breaks the cycle here? Who gets the body moving again and strengthens and stabilizes?
Doctor.
Not a medical doctor. Who does exercise? Physical
Physical therapist.
or an occupational therapist. They shine here. They'll get your body moving properly again.
I've heard it.
I'm not going to a physical therapist, right? It costs $75 and I want to see it 3 times a week.
Yeah.
So you wind up hurting so bad. So bad. You can't get on my table if you wanted to. It's past what I can help, right?
Yeah.
Who breaks the cycle here? They're not evil. They went to school for the same reason I did. They wanted to help
Doctors.
you. A medical doctor or a surgeon, right? Look at the cycle, though. You know somebody who's in the cycle right now.
Oh, yeah.
You know where they need to be. It may not be here, right?
Yeah.
They may need to be somewhere else.
Right.
Now you know where to take them. You know what to do for them. You're now empowered to go out and do the right thing and use chiropractic properly,
Wow.
where it belongs in the cycle. Think about this too. All this stuff, that's called prevention. This is called treatment. What makes more sense, prevention or treatment?
Prevention.
It's not really a debate, right?
No.
It's a decision,
Right.
whether you're going to do it here or here. So you got the information, you got the tools, now you know what to do.
Yeah.
It may not be here, right?
Right.
But you know what to do. So whoever you were thinking about in that cycle, tell them what to do properly. Once a week. What is it? Once a week, baloney. You want me to get my spine checked once a week? Well, here's the study. Dr. Wiedemann, he did a study that changed medicine and chiropractic all at once. He took a rabbit and he tied up the rabbit's knee for 1 day. And he took it off. And then he looked inside the joint and it was totally healthy. Totally healthy. And he did it for 2 days. And it was totally healthy when he took the binding off. After 3 days, they started to see some scar tissue forming because it wasn't moving. Loss of motion, dysfunction.
Right.
After 7 days, he saw a lot of scar tissue. But after 2 weeks, 14 days of immobilization, they're the first signs of eburnation in the subchondral bone. That is exposure, wearing, and hardening of the bone because of extended fragmentation, breaking down of the layers of cartilage in the joint. Such changes are not reversible and identifiable radiologically on X-ray as narrowing of the joint space. Ever had an X-ray where you saw narrowing of the joint space? Osteophyte formation, spurs, and subchondral sclerosis, calcium being laid down where the cartilage used to be. That's collectively called arthritis.
Right.
So after his 1987, when he did, before 1987, you ever see anybody have knee replacement?
Yes.
What'd they tell you before 1987?
Don't
Don't move, stay there, let it
Right.
rest, let it heal. But after
Now they
1987,
tell you to get up and
they're not even
Right.
out of anesthesia.
Yeah.
They get that thing on their knee and they wake up and they're like, oh, my knee's moving. Because
Yeah.
they don't want to get they don't want any scar tissue in there. They want to keep the joint moving. So when the bone's out of line, when it's not the subluxated, it's not moving properly. So when we adjust the spine and it starts moving again, get full range of motion, we reduce the risk of arthritis because we're increasing motion. So there's 2 reasons to get checked every 7 to 10 days. One is to obviously eliminate the interference between the brain and the body so it can heal itself, but to help avoid arthritis. Does everybody on the other side of that window get checked every 7 to 10 days at a
No.
chiropractor's office?
No.
No. Are they dying, dropping like flies? You have to tag their toe and stick them on the side of the road so the police can pick them up?
No.
No. What do they complain of as they get older, though?
Pain. No, that.
Body
lack of
aches.
mo-
Body aches from what?
Lack of
Joints,
movement.
and that's called
Arthritis.
arthritis. That's all. It's because of lack of movement. That's all. So you got to keep the body in motion. And partly an adjustment does that for your spine. You want a prescription? Everybody wants prescriptions these days. Here's your prescription. Eat well, move well, think well, and stay well adjusted. Now look at this. I'm only an expert in this. I can't tell you about this eat well, move well. I can give you just general ideas. But this is how you stay healthy. You can't get adjusted and expect to never have to eat well again, right? You can't eat well and expect never to be able to have a stinking thinking, right? You can't think positive thoughts and never have to exercise again. They're all independent, but they have to be done together.
Right.
So eat well. Don't eat it if it's not food. That's all. If you read something on a package and you can't pronounce it, don't eat it. Anybody know what propylene glycol is? Propylene glycol.
No.
Oh.
Antifreeze. Antifreeze for your car. Antifreeze. Go to the Dunkin' Donuts website.
No way.
And go to Coolada.
Oh no, I had one today.
And I want you to look at the ingredients and tell me what one of the main ingredients of a Coolada is. Propylene glycol.
No way.
Don't believe me? Go to the website. You like the flavor shots in the coffee there?
No.
Good, because guess what one of the main ingredients of a flavor shot is?
The antifreeze.
Propylene glycol.
Wow.
Don't be astounded. That's just one company. I'm picking on them. But they're all the same.
I want to know what they put on that chicken.
Ooh.
Yeah.
Enough MSG to sink a ship, probably.
I know.
It's not just through the mouth. It's through the arm, too. Vaccines.
Yeah, they will
I
freak me out.
am not against vaccines. I am against the preservatives that they put in the vaccine.
Yeah.
1 ounce of formaldehyde in your bodies, your adult bodies, with 70 trillion cells, 1 ounce, 1 hour, you're dead. Dead. D-E-A-D. Dead. Guess what they stabilize the vaccines for the kids with? Formaldehyde. Don't believe me, ask your pediatrician. What else do they put? Remember when we were kids, we used to play, remember? You're too
mercury.
young. Yeah, you played with the mercury, remember?
What?
In school, we used to play with the
Yeah,
mercury,
we
remember?
did. Yeah, we used to wait till the thermometers
Now,
broke.
what do we know about mercury?
The hazmat guys go in there now.
Guess
the
what they
brain.
stabilize vaccines with?
Mercury.
Called thimerosal, mercury. Do you have to inject this stuff into your kids? No, they have the same vaccines without those preservatives, but they don't last as long. So you just call ahead to the pediatrician.
I was going to say, they don't tell you that.
Well, I know, but you have to be proactive, and you ask for the ones without those chemicals. And they don't last as long. They have to keep them in the refrigerator instead of on the shelf. But now you're not exposing your kids to those harmful toxins. Why do they put those things in the vaccines? Make them last longer. So whether it's through the mouth or through the arm, if it ain't food, don't eat it. Got it? Move well. How many minutes a day did I ask you to exercise? How many minutes a day?
15.
15 minutes. That's it. You got to get outside and move.
I run for an hour every day.
You get another high five. We're going to get you moving too.
I walk with my dog when my dog walks me. That's probably half
more than
my
15 minutes?
problems.
More than 15 minutes?
Oh, yeah.
All right, you get a high five. And I know you
You play
got
soccer and dance.
All right, give me a low five.
Yep.
Good job.
He's a puppy. Oh, yeah, we run.
Think well. Does anybody know a Nancy negative in their life? Nancy
Yeah.
negative? How healthy is she?
Not healthy.
Anybody know a Patty positive in their life?
Oh, yeah.
Yeah.
Somewhere.
How healthy is Patty?
No, very healthy.
Does you think there's any coincidence? No. Stay well adjusted. Doesn't it make sense that no matter what your condition, whether you have diabetes or cancer or liver problems or solar plexus problems or ear or neck or shoulder, it doesn't matter. We need to be better off with having a healthy nervous system so your body can fight it off. Stay as healthy as possible, whether you have those conditions or not. Chiropractic can't fix those conditions. What we can do is remove the interference so the body can heal itself. That's it. So if everything I told you is peer-reviewed, every slide, and you can ask me any question, and I can look up and show you the research, which I pull off the internet all the time,
Wow.
then who should have their spine checked?
Everybody.
Especially
Everyone.
Yeah, especially babies.
Should everybody be adjusted?
No
No, exactly. Only if we find a...
problem.
So don't get on the table and get all upset at me if you don't hear any popping or cracking.
I'm like, no, I'm feeling well. No.
I don't want you to hear that noise every time. I want you to have a perfect checkup. That's what the star is for. I'll put a star in your card and I'll tell you don't pay next time. Because if I check you and you're healthy, free visit. I want you to be healthy.
Well,
That's the
hopefully
goal.
someday.
You will get there. You will get there. So It's not about popping and cracking the spine. It's about putting the bone back in line so your body can heal itself. My mission in my office is to detect and correct subluxations in a fun, safe, and caring environment. All right, well, fun and safe, not some caring. But, and to restore and maintain the health and wellness, not just of you, but of you, your friends, and your family, so we can change our community. When you have a headache, how do you react to your family? Not so hot.
No, I'm on edge.
But if you don't have a headache and you're functioning 100%,
Fine.
see how we can change the community just in that little thing?
Yeah.
And it's not just headaches, it's any
Everything.
condition, right?
Well, yeah.
You feel great when your middle back's tight?
Yeah.
Yeah. So you get it.
Yeah.
You
Because
change the way you
I'm like,
interact with
I
people.
was just saying, I'm lightheaded, I can't see well, my eyes are always...
You're like a different person today than the first time I met you.
I was just like spaced out, I was hurt when I came in here.
Or just at the top of your neck, whether you
Yeah.
liked it or not. How do you help me fulfill my mission?
Refer your
Same way
friends
you
and
got
family.
here.
Yeah.
Send your friends and family. I used to have a star because that's a perfect checkup, but this is better. See this lifesaver?
Uh-huh.
RYF. Throw them a lifesaver. And don't tell them anymore, you should go to my chiropractor. He'll pop and crack you and you'll be better. In the same amount of time as it just said to say that, isn't it easy just put both hands out like this and say, hey, you might want to think about going to my chiropractor. If your bones are out of line in your spine, wherever the nerve goes to, doesn't work properly. All he does is put the bone in line, take the pressure off the nerve, so your body can begin to start healing itself. How tough was that?
Right.
You didn't use the word pop or crack.
No.
Yeah.
And that's the truth, though. That's the science. That's the understanding of chiropractic. So no more pop and cracking business, telling your friends. Got it?
Crackling pop.
23 years ago, I adjusted a child that was in a coma at Children's Hospital in Cincinnati.
Mhm.
He had been in the coma for 23 hours. When I got to the hospital, his neck was out of alignment. You see the first bone and then the second bone in the neck?
Mm-hmm.
See how close they should be?
Mhm.
Mm-hmm.
When I got there and felt his neck, they were apart like this.
Oh, my.
Feel behind your ear, you'll feel a little bump.
Yeah.
Feel a bump?
Uh-huh.
Feel under it, it should be mushy.
Yep.
Yeah.
That's what it should feel. Instead, I felt that. Feel that.
Oh, my.
Feel it? That's C1.
Wow.
Ooh.
I told Mary when I put that bone back in line, his mom, that the brain will fully communicate with the body. If the body is so sick, he may graduate. If he's healthy enough, the brain will recognize that and he may wake up. But one or the other probably will happen. Do you still want me to adjust him? She said yes, and I went to the table, to the bed. I can't get to the head of the bed because he's on a respirator and ventilator.
Right.
I put my hand through the tube. I put my hand right on that C1. And when I pushed it just a little bit, it went that loud. Loud enough to where over the breathing machine,
Ooh.
Mary heard it. And her eyes get wide. But nothing happened. He just, no changes in the monitors at all. She went and picked up the phone on the wall. I'm holding Stephen by the waist. He's about 10 years old. How old are you?
10. She just turned 10.
10. Stephen was your age. She picks up the phone, call home, and said, Rodney, they have 5 kids. Korsen's here, but. As she says, but, Stephen's eyes go wide. He starts fighting the respirator. Every alarm goes off, like negative airway pressure, oxygen, everything, like 4 alarms. I was paralyzed in fear because I didn't know how to take that stuff out. I never put it in.
Right.
I'm a chiropractor, not a medical doctor. 2 nurses rush in, push me out of the way. Now I'm against the wall. Mary drops the phone on the floor. 1 nurse goes to the other side. The nurse and Mary, the lead neurologist in the hospital, Dr. Franz, walks into the room. He's at the head of the table. He's telling Stephen, calm down, let the machine breathe for you. He's 10 years old, he's wide awake.
Right.
They realize that's not working. So they take off the ventilator, they take out the respirator, and he starts breathing on his own. They shut off all the alarms, and the room starts getting quiet. And I'm standing against the wall going, what just happened? And I hear next to my foot, go, Rodney's still on the phone.
Oh, jeez.
Oh,
I feel
jeez.
like, Rodney, get the kids together, come up to Cincinnati, because we were in Indiana. Come up to Cincinnati, Stephen's awake. I hang up the phone, Stephen picks up his head, looks through the nurse and his mom are on this side of the bed, directly at me and says, I'm thirsty, can I have a drink of water? I'm like, you can have whatever you want, kid. My life was just changed.
Right.
That night I became a chiropractor. Not the year and a half before that I was popping and cracking people's backs. That night I realized what my professors taught me,
Yeah.
that chiropractic is not for making people feel better, feeling good and feeling bad. Chiropractic is about life and health. It's about removing the interference so the body can heal itself.
Yeah.
If you think for a minute I woke that kid up, you're wrong. I didn't wake him up. All I did was detect and correct the subluxation.
Right.
And you want to say that like I adjusted him, everything was hunky-dory? No. It was months before he could talk and speak properly
Wow.
again. It was a long road. His body healed itself.
Wow.
So,
That's crazy.
if chiropractic's not for feeling good or feeling bad, it's about life and health, keeping you healthy, then it's kind of like oxygen, right?
Mm.
So if you guys owned all the oxygen in the world, and I was suffocating, and I only had $20, and you charge $40, you charge $40 for oxygen, but I'm suffocating. All I can afford is $20. Would you let me pay what I could afford? Or would you let me suffocate?
Let you pay what you can afford.
Yeah, and you give me that oxygen, right?
Yeah.
So as a chiropractor, how much should I charge for an adjustment? It's a dilemma, isn't it?
Yeah.
So a year and a half ago, I went to Kentucky to a missions trip, and I was sleeping in the chapel because I smell like a maniac. So they make me sleep upstairs with my son in the chapel. And I realized I need to do that. I need to let people pay what they can afford so everybody can afford to carry my office. That was a year and a half ago. A year ago January.
Oh, wow.
So I changed the fee system in my office for anybody that comes to this class that understands what chiropractic is and wants to use it like my family does,
Yeah.
once a week preventatively. Here's how you do it. I came home, and guess who the first person that walked through my door on the table on Monday morning when I got back from the missions trip? My friend Frank, who's a carpenter. I was like, Frank, I was going to call you. I need you to build a wooden box. I want it to be 12 inches by 18 inches. He comes in with that box. It is 12 inches by 18 inches. It's huge, isn't it? He comes in, he goes, you're very optimistic about this box, aren't you? But that's the box that people put their payment in now. Here's how it works. It's not a charity. It's not a donation. It's a fee. It's just that you set the fee, not me. You pay whatever is within your means. Here's what that means. Everybody knows what their income is per month. Then you know what your expenses are, right? And you have some money left over at the end. That's like the money you go to the movies, you buy a pizza, that's your discretionary money.
Yeah.
Of that money, how much could you afford of that money to be able to come in once a month, once a week, you pay once a month, what's the fee that you could afford, to come in once a week with your family, to have the spine checked, to make sure there's no subluxations. I'm not a good mathematician. I'm a really good chiropractor, but a bad mathematician. So I'm going to use a round number, okay?
Okay.
Let's say you say, for my family, I can afford $80 a month. Divide whatever the number that you came up with it by 4. Now you know why I chose 80?
Yeah.
Yeah.
How much is that? 20.
Yeah.
So when you come in on Monday with your kids,
Yeah.
how much did you put in the box?
20.
$20. You lay on the table, I adjust you, and I say, you must have had a bad weekend. It's really tight. I'm not sure you're going to hold that adjustment because of stress. I want to see you again on Wednesday. You come back in on Wednesday, how much should you put in the box?
20.
No,
Nothing.
Nothing because
It's a
you
monthly
already
fee.
paid.
You've already paid for the week.
Oh. Gotcha.
Your husband comes to the class, and he comes in on Friday. How much should he put in the box on Friday?
That's for, you said for the family.
Yeah, nothing.
Oh,
You've already paid for the family.
Huh.
He's included. It's a way for me to take care of my patients like my own family. You can never tell me I'm making you come back too much
Yep.
because for the money, because it's not for the money.
Right.
Right.
Now, when I came home and told my wife, we're going to put a box on the wall, let people pay what they can afford,
Yeah.
she's like, do we have to sell a house now? Or I'm like, I think it's going to work. We're going to use 3 rules that are going to make this thing work. And here are the 3 rules. It's not a donation or a charity. It's a fee. So just pay it once a week. Unless you have a reoccurring expense. You know what that is? The car breaks down. The hot
Oh.
water boiler needs to be replaced. You don't have the money that week. Just come in anyway. Just don't put anything in the box. It's anonymous. I won't know the difference. But don't miss your appointment. If you think you're the one putting the money in the box, you're sadly mistaken. God's putting that money in the box. You just have You're using your hand. So
Yeah.
don't worry about if you don't have the money in your pocket that week. Don't even tell me. People say, I don't have it this week. I'm like, I don't care. Just get in and get checked. That's the most important part, right?
Yeah.
If what I said was true. So just get in. Second rule, be regular. You know when people get upset with chiropractic? And they come in, they get popped, they feel great, they think I fixed them, and then a week later they're like, wow, that chiropractor didn't fix me, it's back. Now you guys know how funny that is because it was stress in between.
Right.
You think I just put it in, like I didn't put it all the way in line?
Right.
Or do you think maybe the muscle got tight and pulled it back out? But they don't understand that because they've never been to the class.
Right.
They think chiropractic is just to fix the pain.
Mm-hmm.
They don't understand that. It's just to remove the subluxation so the body can heal. So if you come in regularly, preventatively, once every 7 to 10 days, just like Dr. Wiedemann's study showed, you're never going to be disappointed with chiropractic because your body's constantly healing itself. And last, I know what you're putting in the box is less than what I charge at the front desk. So what? That's what it's designed for. So if I'm just making less per person and I want to keep my income the same, what do I have to do?
Get more patients.
Help more people, which is what I went to school in the first place for anyway, to help more people.
Yeah.
Hopefully you do that someday too. Now, if you want to use my office like a Tylenol, you want to just come in when you're hurting, that's $40. And you have a tan card up front. Everybody's got a tan card. But if you want to use my office like my family does preventatively, and you pick the fee, then you'll tell them at the front desk next time you're in, I came to the class, I want to use the box.
Oh, okay.
They'll take your tan card and they will put it in the electronic health file. You'll never see that one again. And they'll give you a white card. They look identical. It's just white. That white card is a signal to them that you're using the box and they're never to ask you for money again. You just put your initials. They'll only ask you for your initials so we know you were there on that date. And then when you come back, you make the payment. Payments between, like I said, you, the box, and God. If I don't see you for 2 weeks, and you don't call me and say, I'm taking care of Aunt Mary in Tuscaloosa, I had to leave town. Or I'm leaving for the summer, I'm leaving for the winter, I'm going to Florida, like some of my patients do.
Right.
If you tell us that you have something that came up and you can't get here, and you call, we'll put a yellow sticky on, it doesn't matter how long you're away. When you come back, we take the sticky off, you take over where you left off. So don't think I'm being a stickler about it. But if you want to use me like a Tylenol, $40. But if you want to stay healthy, I don't care what you pay. Don't ask me for a receipt. How do I know what you put in the box? You want a receipt? Like for taxes at the end of the year?
Right.
Write a check.
Oh,
It all goes in the same bank account anyway,
All
right?
right.
So write a check. You've got your name on the front, my name on the back. It's a great receipt, right?
right.
So just put a check in the box instead. Well, every penny goes into the bank. So it doesn't matter to me whether it's check or cash. So that's the way you get a receipt. I have some bad news for you guys.
Oh, no.
Bad. Class is over. I know you wanted to stay
Oh.
all night long. I know. You did. But it's over.
All right.
You got any questions? You guys got any questions?